So can everyone see the screen?
Yep.
Great. So to start us off in a good way, we just want to acknowledge that we are on the land of the traditional and unceded territory of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh. And for that, we are grateful. All right. So as I shared earlier, we've covered a lot of ground in our first session, and as well between emails with Sally and emails with Leo, we've also been able to get to some of our decision points. So our agenda for today is fairly informal. We're hoping to have some discussion just around external referrals and some questions that Leo has. At a very high level, we can go over some of the remaining validations. Some of that we have already done over email, but I do have slides. Jessica is here from provider engagement in case there is any demos that need to be reviewed. And then at the bottom, there's just some FYIs of some of the work that occurred, Leo, while you were away. Is there anything else for the agenda that folks want to call out?
I just
No.
wanted to make sure that the Andy had brought up something about encounter types last time that I didn't have an answer to because it seemed like something that would be decided upon by somebody who had more knowledge about how
Yeah.
that, yeah. I just want to make sure that that's been taken care of.
Yes, great memory. And in fact, we have some slides on that. Do you think it would be useful just to go over some of the validations and then we can get into the discussion? Because I think the validations will be quite quick, Leo.
Sure.
We can jump to that. All right. I'm just going to go into full screen mode here. And Leo, these are the same slides that we're going to share with your clinician and nursing group upcoming on November 30th. So just jumping ahead. Is it in full screen mode? Are you seeing it in full screen mode? You're not, are you?
No, we still see your PowerPoint.
Yeah, I figured. Thanks, Polly. I'm just going to reshare. All right. Are you seeing me in full screen mode now?
No, we are.
Great. So jumping ahead to that, for encounter strategy, through discussion with Leah, with Sally and with the team, Leo, where we landed was on using the recurring and pre-recurring encounter types. So we had talked about potentially not doing that in our last session, and then through discussion, we had landed on that this would be easier for your clinic. So this is where that decision is. Any questions with that or things that people from the team want to share? No? Okay, then I will move forward with that being validated. And then the other validation, which we did over email, I'll just skip ahead to that, was your referral. And so we've taken from your paper referral. Thanks for sending that over, Leo. And we've put that, and I've sent this to you over email, and we can show you in the system today if you're curious. But we've put that directly into Cerner as well with your reference text, and then into the referral text. That was our second validation. The other validation that we did want to check with you today, Leo, was around the requisition manager. So I'll just jump to that one. And Leo, you had previously validated that one via email. So I'm assuming that one's good to go, correct?
Is this for the lab requisitions?
This one, sorry, I was referring to the referral text, which you validated over email. So we're good to go there, correct? And then labs is up next.
The referral, the referral from Cerner, that looks good to me. I just wanted to make sure that everyone's aware, like my team is aware. So really, just so Sally knows that the referral form looks like it's like word for word text copied into the actual auto text. For the pop-up though, it's using old text from the previous referral form for the inclusion and exclusion criteria. So there is a little bit of a wording difference, but overall it seems like the same. And I thought that it's nice that the inclusion exclusion criteria are on the pop-up so that it saves the referring physician or nurse practitioner some time, that they can see right away that the patient wouldn't qualify for the program, so they don't have to go the one step further to fill out the form and then find out that, oh, the patient actually doesn't qualify. I think it makes sense to have it there, but that also means that if we have any changes to our inclusion exclusion criteria, we'll have to change it in 2 different places.
Right. Okay. And that would be just one ticket with Cerner though, right?
That's a question that I had, is like, how do we
I'm like
how do
looking
we
at
make
the team.
changes? Do we have free reign on changing it ourselves somehow, or is this a ticket to Cerner?
I believe it's a ticket, but Janice might be better to weigh in on the future process of what that's going to look like for us.
Yeah, it is a ticket to Cerner, just kind of how things are done now with when you need something done by IMEDs, it'd be the same process.
Will we be given some training on how to create this ticket to Cerner? Because I actually don't have any experience
Oh,
doing that.
all you need to do is, hi, Erica, I need help. And Erica's team will take it away and liaise with IMEDs and everything. And there's also, we have like a front end change request form that we recently implemented for VGH. And so like managers and educators can use this like front end web form to like submit any change requests. You can call the service desk like you normally do, or you can also just reach out to Erica in the future, because they're not going away after we've implemented Cerner, just like how Erica's still around with Profile in Paris.
So that's I know Erica is very responsive to emails, but like what if she's on vacation or something? Is there like a generic CST email, or do I just go call the service desk number?
Hopefully her out of office has somebody covering, but if all else fails, yes, you always can call service desk. There's the NTT agents that will take your call, they'll log a ticket, and then once they log a ticket, they send it over to informatics, and then it shows up on our dashboard. And we have a triager that works every single day, Monday to Friday, that always monitors tickets coming in through the service desk. And then if you use the front end web form, which is given to managers and educators, same thing. Once you log the ticket and hit submit, it shows up on that same dashboard that we monitor every day, Monday to Friday.
Okay.
So there's a variety of ways to get to us.
Okay.
Yeah. And similar to what we have for what you might be familiar with Profile EMR, we have a number of clinical informatics specialists focused on Profile that work on that for community. We're going to build a team in the same way for Cerner and have a number of CISs for that work for community. We're just in the process of hiring folks and beginning that work. So hopefully there'll be a whole team to support eventually. So it sounds like we're good to move forward with reference text then.
Yeah.
Thank you. Okay. And then the next bit for validation that we did want to check in with you, and you just mentioned it, Leo, was around labs. I'm glad you did, because I think we left this one kind of as a tentative. Sorry, some of these slides are meant for the bigger group demonstration on Thursday. So I think we had tentatively left it as we'll have a clinic flag, and the clinic flag will be tied to the clinician group, not the physician group. So we just wanted to confirm that we heard that right in the last session. And then we've also got the message center pools, and we're going to review these and these names with you, Sally, on Thursday to make sure that we've got the right folks for the right pools, because Katrina hasn't built them yet, but she will.
Okay. Sorry, couldn't read and listen at the same time. Okay. Okay, perfect. So the clinic flag is for all patients. Okay, and then we can review the message center pools in detail later. I see some changes that are needed.
Okay. We're going to confirm them on Thursday when the team's with you, Sally. But I think that the main confirmation for today for Leo is to know that there will be a flag. It won't be linked to your provider group. It'll be linked to the clinical group. So that'll be your nurses and your allied. And to just make sure that you're comfortable moving forward in that way.
Wait, not for the entire program, Erica?
Yeah, so how we've set it up so far is there's a clinical message center pool, so that's your allied and your nursing staff, and then there is a provider assessment pool, so that's all your physicians on the team, and then there's an admin pool. And maybe I'll pause there in case Katrina, because Katrina's going to be setting this up for us, and she's on the call in case she wants to add a little bit more.
Yes, what you said was correct.
All right.
Okay, because the way I envision it is that the clinic flag would be for all patients followed by GAP, and then the flags would go to the admin staff.
Okay, so
Okay.
you're envisioning it as the flag would actually be linked to the program admin pool? Is that-
Correct,
Okay.
because there will be a number of patients that do not have clinician involvement. They might just be connected with a physician, and it's important for our admin staff to cancel any community-based appointments with our physicians if somebody is
Ah,
admitted.
ah. Um, Katrina, are we able to do that then?
Yes, we can. And I'll make that change to the ticket.
Excellent. Leo, does that work for you then from your perspective? So your clinic flag will be linked to your admin pool?
I just need a short reminder. This is clinically related to when patients get admitted to hospital. Then our program, whoever is in this flag pool, gets notified that the patient has been admitted. Is this correct?
Correct.
Okay, yeah, that makes sense then. I don't think
Yeah.
that the physicians necessarily need a notification every time a patient gets admitted, but the PAs do.
Okay. All right. We'll move forward in that direction then. And then moving on to labs. So our understanding from the last session was that for most of the clients, they're being handed their lab requisitions and then going to a place like Life Labs. So we had talked about the three options, and I think we had left it a bit tentative, likely thinking that it would be option number 3. And we did validate with Sally that most of the clients are being handed their labs and that the automatic print option would be the way you want to go. But we just wanted to create space to just ensure that we had that correct before we moved forward. And Katrina, I don't know if you want to share anything further with this one, because I know you were setting that up as well.
No, just that this will automatically print when the orders are placed. So you won't have to do anything, it'll just automatically print.
Just out of curiosity, am I able to select like print to PDF? Just if I wanted to not print out a paper copy?
So with this option, I don't believe so. I think it just auto prints, but you can go in and do the PDF.
You can always reprint.
Yeah, reprinting.
Yeah. So one
Awesome.
will automatically come out, and then you can always go in and reprint something. And if you reprint, you could technically save it. There's just a lot of steps to get to saving it as a PDF and on your desktop to send out. It's something that we can teach you, but full disclosure, there is lots of clicking.
I see. Okay.
Leo,
Yeah.
what would work better? And I guess my other question around this, now that we're talking about the details, when we say designated printer, is each physician's profile attached to a designated printer, or will Cerner know that the designated printer is the printer that they are in. I'm just thinking, for example, sometimes if the physicians are using different exam rooms, if their profile is set up with a designated printer and the printer is the
Yeah.
printer in the room beside theirs, then that's
Yeah.
not going to be useful.
Printing is configured by workstation, by the computer.
Okay.
Yeah.
Okay, that's perfect.
The only time is like, let's say you're working from home and you need to remote in through remote access, then obviously that's not tied to like, then you're at home and it doesn't go anywhere. And then I guess, Jessica, a question for you, because you probably work with a lot of different physicians. When they are working from home remote and they do want to print, let's say, a lab requisition, there is usually a drop down that they can select and it will go to the printer at the hospital. Does that work?
That's correct. Yeah, I actually just got in and tested it on my side, and that's what it looks like. If they go in and they right click and reprint the requisition, it looks like they're getting the hospital printers. I have to confirm if print to PDF is an option on the list. I know in our build domain, there's a test printer, but I'm not sure if that's the same on the live side. I'd have to follow up on that. But we do have a print to PDF workflow, I believe. So I can take that away and get more information. And Leo, we can work together to streamline that process for you and other providers that may need that.
Yeah. And Dr. La, I think that one advantage is because you already have Cerner access through St. Paul's. You could probably just use your current active profile and do some testing.
Yeah.
Yeah, that'd be helpful. Like one of the things that I'm just thinking through my head right now is it's quite hard for me to make these decisions, even with my experience at St. Paul's with Cerner. I like right now it's set up so that it prints automatically. And from my experience at St. Paul's, occasionally when I'm in the clinic, which is on the 5th floor of Burrard, and I do like a lab rec, for some reason it prints like randomly on occasion to like the endocrinology clinic, which is like in a different floor. And sometimes it prints to the Burrard building, which is where I want it to go on the 5th floor, which is where I'm located. And I noticed that there's like a selection drop down, and I was just wondering if like that would be an option to just make sure that it goes to the right printer. And then the other thing is just like, it's very hard for me to make a decision about option 1 and option 2 without actually seeing it and playing around with it. It's just a little piece of feedback that I can give you. I just don't know how it looks like to make that decision.
So I think we're just going back to option 1, like the requisition manager. I think when we talked about it last time, we said there is functionality in Cerner that will be available for Richmond that allows you to e-fax like a lab requisition. It's just we weren't sure what your workflow was, and I think you had mentioned that it's more common for you to like have something printed out so you could hand it to your patient. And so maybe you wouldn't use the e-faxing option very often. And so it might be more work to have it not auto print so that you can just, take it and hand it with your patient. You'd have to manually go in and always have to like print it.
Yeah, it's pretty close. I would say like, it's more common that we print it out, but it's like maybe about, for myself at least, 60-70% of the time. So there's still a significant portion of the time where I'm actually just e-faxing it to Life Labs. So yeah, if I was able to actually see the workflow, like see an actual demonstration of option 1 and option 2, I might be able to make a better decision. But as it stands, I don't know exactly how that looks like. So I can't really say for sure if those options are actually not preferable.
Erica, Jessica, are you comfortable doing a quick demo?
Well, I can, but Janice, I don't know, and maybe you can lean on the team for this. I don't know if we have, is it set up in our build domain to be able to show the document in
Rec Manager?
Yeah.
Yes.
I don't Let's see.
If anything, you might need to register a patient in the Prince George location, BC Cancer Prince George, because you know how we facility flexed e-faxing to just that one location as a pilot. So the button to click fax will only show up if your patient is in that location.
Oh, okay. I don't
So
have
just
that
need
right.
you to register. I can register a patient. I don't mind doing that. If Erica, you wanted to continue on with your slides, I can quickly do that.
Sure. Well, why don't, while Jessica and Janice, while you're doing that, because this was our last decision point. Let me go back to I've just unshared my screen. Let me just travel back to the agenda slide. And maybe what we can talk about, Leo, while they're putting that together for us is just some of the options for generating external referrals. Yeah, so I'll just screen share again. You can see that agenda, Leo.
Yes.
So I think we've moved through this really quickly, which is great. And we've signed off on those the referral auto text. We've talked through clinic flag, which is great, and we will change that to make sure that it goes to the admin box. So thanks for that feedback. And we will just wait for the demo to confirm on what we want to do for labs. So, and also just from the email, and you probably saw this just as an FYI, the Geriatric Depression Scale 30 was added to your power forms for geriatricians. And there's a new link for the road safety forms that's going to be added to your M page. And this was an ask from Dr. Clara Sue. And so we went through the different committees to get that approved by the medical working group, and that'll be added as well. And I think that'll be at both of your sites that you work. And then lastly, your follow-up orders will be Geriatrics New and Geriatric Follow-Up. So those are just some of the work we completed kind of in the past 2 weeks. But what we wanted to chat about, you had mentioned you were curious about generating external referrals. So say more about that, and I think some of that might get solved with Profile. So and I was curious, Leah, was it the Alzheimer's First Link referral that was coming to mind, or which ones was it?
I mean, for external referrals?
Correct.
Oh, I'm thinking about, say, if I needed to refer to like a cardiology clinic that's not on Cerner. It comes up quite frequently that the physician that I'm trying to refer to, they're not on Cerner.
Yeah.
And typically on Profile, what I would do is I would generate an external referral, and it's just like a templated form. And I just type in like the reason for referral and then fax it to the physician. How do I do that on Cerner?
So is that the templated forms where it's been sent to us at Profile and we've built it as a fillable PDF? And so you could go in and it's their clinic's actual form?
Oh, that's a separate issue. Yeah, I'm talking about clinics that don't have actually like their own form.
Okay.
I'm just sending them like a generic letter, and Profile has that ability to create this letter.
Okay, so you're just wanting a generic, so you're not talking about the PDF fillables that the programs have sent to us and we've built in Profile, and then you go in and you complete them. You're just wanting a generic referral workflow.
Exactly. The workflow that I use on Profile, I believe it's just new referral. Like
That's right. Yeah. My understanding and Janice, she might be doing more than two things. So Polly, maybe you can help me with this as well. Is my understanding is you can place a referral for a clinic that is not on Cerner, and then we would create some kind of generic letter template for you. And then it could be faxed from there, is my understanding. And then I believe the admin staff would have to help Oh, actually, no, they wouldn't need to upload it in because it would be in the system. So I believe the admin staff would help with the faxing out of it. And
Yes, so there is an order in this in system. It's called, referral to clinic not on CST Cerner. It's a long title, but it's very clear. And when you place that order, what happens is that it will generate like this template. It's very basic information. It has like your patient's demographics and a list of their medications. And some clinics can use that to, fax to that information to the other clinic. If you do need to create some sort of like letter to like accompany your referral, I think one option is just to create a note in the system. And then I'm wondering, Jessica, if you could help demo the provider letter in system.
Yeah, we can look at that. Sure.
right.
Yeah.
I'm gonna stop share, Jessica. Are you ready for us?
I can show you the provider letter now. Let's see. Yes, I can. One moment. Looks like host has disabled screen sharing. For
Oh,
me.
let us do that for you. Go ahead, Jessica.
Okay, let's see. Share screen. Can you see my screen now? Should be able to see tower chart. Okay, great. All right, so I am in a patient's chart right now. And for the provider letter, and Erica, keep me honest here, but this under communicate, when I'm in the patient's chart and I come up to the drop down, I can select provider letter from here. And this allows me to select a provider, which it's pulling the providers that are listed on this patient's account that were entered upon registration. So the primary care provider, for example, shows up there, the referring provider. It also shows me the consulting physician as well. So I can pick a provider from here. It doesn't have to be one of those providers. You can also search for the provider in this search field. I've selected Dr. Grafstein from up above, so now I can see him in my recipient list down below. And I can proceed by selecting OK. There's a subject drop down where I can change the subject, but because I already picked provider letter from that drop down, it displays for me there already. If I need to, I can, there are other options in here as well. This is just the subject line though. I just want to point out that provider letter is there, but you also see that save as, it defaults to provider letter there too. So it'll actually save in the chart as a provider letter, subject line is provider letter. And I can come down and I can add my information down below. And Erica, sorry, I may have missed this, but was there something specific that you were asking me to demonstrate here, like auto text, or was there anything specific that you wanted me to include in the provider letter for this demo?
No, this is great. Leo, do you think you would use an auto text, or do you think like in Profile EMR right now, is there a code that you're using that provides the template some of the information for you?
There isn't, because it just generically generates what I need, which is like a template that says like, contact information, and then reason for referral, problem list, which is basically aka past medical history, and then the reason for referral.
Okay.
Yeah.
So would that be a new template that we would build for Cerner based off what they're doing in Profile EMR right now, Jessica? Or
sure, I think that it would be appropriate to build a template, and it would save you some time. You'll also have your microphone where you can, use faster templates and dictate into here as well. But sure, I think it's a great idea to build an auto text. I think, Dr. Lai, we can discuss too if it's, does everyone use the same type of format here, or does everyone kind of have a different way of capturing that information?
I think everyone uses the same format, but I've just,
they use the same.
Yeah, just a question. Right now it says provide a letter internal, and then we've selected an internal physician. Are you able to send it to an external provider? Because that's what it
here. think it's only internal. Yeah, let's see. I'm wondering if any of our provider experience team, the design team is on the line and can speak to this, but I believe it's internal in this functionality.
I think we need to do some more testing because this actually came up during our UBC hospital server implementation last month. I think people were trying to fax it to an external physician. And so I think I just need we can follow up to see what the resolution was because I think they were having issues with faxing to external. And I don't know if they were able to resolve the issue, but at least we have time to sort it out for Richmond.
Okay, and how about that other option that you had mentioned about the CST order, about was it like clinic not on CST Cerner? What does
Yeah,
that look like?
maybe we can see that order, Jessica.
Sure. Do you want me to
Yeah.
back out here? Just
That'd be great. Yeah.
I can do that. So I'm back on my provider view, and when I click outpatient quick orders, let's just take a peek over here in the lower right corner. There's the RHS referrals, referral to clinic not using CST Cerner.
Actually,
That's
Jessica,
sorry.
what I would actually recommend is because if we select a clinic that is opted in for Rec Manager, what actually auto prints will show up in Rec Manager, and then we can actually show what the printout looks like. And Polly has a patient ready to go to demo the Rec Manager, so we can just do it at the same time.
Great, let's do it. Holly, if you don't mind giving me the patient, please.
Yeah, of course. I'll put in the information here on the chat. Give me 1 second.
Perfect, thank you.
Or did you want to continue being hands-on keys, Jessica? Or did you want Polly to take over? It's up to you.
I don't mind. I'm here, so I can keep it up. And if anyone wants to add anything, then please feel free. Okay, let's see. Oh, sorry, that's not what I was going for. Why did that not? Let's copy. One moment.
Oh yes, Zoom does that. It won't allow you to copy and paste.
It
No.
won't. Okay,
Well,
that's
we
okay.
can read it out for you.
Oh, sure. Nope, I can do it this way.
Okay.
744. Oh, okay, sorry. What can you maybe just tell me the patient's
Yeah.
name? Go that route.
RHS Elder Care. And then if you hit enter, there should be only one.
Right.
And you have to choose the St. Paul's Healthy Heart Rehab, because that
Okay.
location right now has a requisition manager with the eFax functionality. So if you go, it should be set up. I have a blood test already. You should be able to go to
Sorry, print
both.
PDF.
Mhm.
If you want to go to Rec Manager, so they can just see the button.
Sure. Yeah, let's see. One moment. Requisition manager, which is up in the toolbar. Not sure if you were able to see that on your screen, but okay.
The second one.
This one here.
Yeah.
If you hit
And
print selected, right?
if you hit laboratory requisition,
Okay.
and then here it'll say the fax button. So if you click that,
Okay. Fax successfully submitted.
so if you
Oh.
select on a drop down, so Dr. Lai, if you go click on the drop down here, you can choose to do like Life Lab Central Intake, which is for all the Life Lab here on Lower Mainland. The caveat for it is because we're going through the central intake, it'll take about 24 hours for processing. So if it's anything stat, then we recommend manual faxing if you know where the patient usually goes to, or if it's a mobile lab, you can manually type in those fax numbers. But if it's just kind of general routine, not stat, and it can be processed for more than 24 hours, then you can select the Life Lab and it'll just go automatically to Life Labs. And that will be the eFax version of this.
Jessica, if you just want to select manual fax and then hit the fax button, then they can see what it looks like. they'll get a prompt right there, and then you put the fax number in.
Oh,
you're
I think
good.
Dr. Lai, you're muted.
Oh, sorry. Yeah, the manual fax interests me as well. If you send like a manual fax through Cerner, is there a way to tell that the fax actually went through successfully?
Not on the front end. And so the reason why this has been a slow rollout is transcription services is setting up sort of like a structure to monitor faxes. And so their role is to monitor when a fax fails so that they can contact you and let you know, because there is no front end way to notify you. So as transcription services builds up their staff group, that's when we're able to roll this out across more and more sites.
Okay. And the print requisition button, that will allow us to just print it out and give it to the patient as well.
Mm-hmm.
Okay.
So this is what we were saying is if you 80% of the time need to print and give a requisition to your patient, then as you can see, it's an extra step for you to have click the button, go in here, find your patient, and then hit the print button. Whereas if you always need to, majority of the time, give it to your patient, then we can set up the auto printing to go to like a designated printer and you pick it up and give it to your patient.
If we decide on one option and later on feel like we need to switch the other one, is it quite an easy transition?
It will be this, I think this one will require the IMEDs to spend more time configuring it. So it's the same process. You submit a ticket, it goes in the queue, gets prioritized. I think this one is a little bit more complicated than just fixing your like your reference text. It seems a little bit easier just to edit, but this one would require more configuration.
Thanks for demoing it. It gives me a better idea. Yeah, it's hard to decide because a lot of times we're printing to PDF to email it to the patient. And in that case, I don't know which option would be the best.
You want to demo the IPPDF one now, Jessica? So here, as you can see, the rec manager will display multiple patients kind of in that location. Whereas if you go here, it's just your specific patient in context and all the things that are kind of in their queue.
Same thing when I come in, I can open up the requisition, I can print the requisition from here, but notice there's not the fax option. Once the rec has been printed, takes a moment to gather, document ready, the print window will appear. And this allows you to print the requisition. Let's see. Yeah, so I didn't think it was going to work for me today. I don't know if it will. No, I don't want to cancel. Anyway, I don't have this set up on my side, but yeah, you'd be able to print a PDF, print to a printer. Those would be your options there.
Jessica,
But
you're
no-
probably remoting in from afar as well.
It's true. Across the border.
Yeah. I think just to keep it simple, we just stick with option 3, which is to auto print. And then later, if we need to print it to PDF or yeah, we'll do that manually. And then if we later decide to change it, then we can submit that ticket to change it. But I think we'll just stick with the third option for now.
Okay. Jessica, Polly, Janice, thank you for demoing that.
Yeah, thank you.
Yeah, that was really helpful.
Jessica, if you want to, the last one was just showing them what the printout looks like for the referral to clinic on CST Cerner. So if you use this specific patient and you place that order, it should land in Rec Manager and you should be able to show it.
Okay, let's see. Wrote the clinic not using CSU discerner. Want them within 1 week. Location will be paper. Reason for referral, any special instructions. What else? I think that's everything there. I'm just going to go ahead and sign. There is a requested provider field, but again, that's not required. But I would put more information there. I just kind of breezed through it just for the sake of showing you what that would look like. Now, when I come down to print to PDF, let me just refresh. And there's the referral requisition. And when I open that one up, again, I have the nice header. It includes my patient demographics, will include the location and location details at the top, followed by the ordering provider. And down below is where you'll see the order, and the order details.
This patient doesn't have any medications, but if your patient had medications, it would list them all out at the bottom.
Okay. So the reason for referral, that the text I'd have to put into when I modify the order, is that where I put it in?
That's correct. There is a reason for referral field there. You can also use your microphone and add some information that way as well. But yes, I can back up if you want me to show that piece again. That's here.
I think the limitation with that is it's 250 characters.
Yes,
Um,
that's right.
But in the order comments tab, Jessica, that one, that's got a lot more, right? So can you try just typing a bunch of stuff in there? And let's see what it looks like on the printout. I think it will show up in the other box.
Yeah, let me just add a few more things here too. Okay, paper. Oh, not going to put that because that might confuse us. Special text. And let me sign. Print to PDF. Going to refresh.
Perfect. So right below reason for referral, there's order comments. And so as you could see, you have a lot more space that you can add stuff to.
And the requested provider, is that the external physician that I'm referring to?
Yes.
Okay.
Yeah, if there is a physician, you can designate the physician there. It is not required. So if you're referring to the clinic, but not necessarily a specific physician, then yes, you can add them there, or you can leave that blank.
And I think, Jessica, I think in the provider search box, like the window, it should pull in any physician that's registered in BC, right?
It should. They should be on the list. Let's see.
Anyone that's registered to the provider location registry, which is like,
Yes. That. Yes.
even
that's
if they're not
correct.
on Cerner, Alio, like you should be able to still find them and put their name in the box.
Okay. And if
That's
I
correct.
do specify a physician there, then does this referral get sent on signing of the order?
No, their name just shows up in that box, in that field.
I see. Okay. Then I guess what we'll have to do then is send a message to the PA to fax this manually. Is that how the workflow is?
So if you're going with the option of just auto printing, then I think it will know like this thing will come out of the printer and the clerk will pick it up and then they'll be able to see and then they'll fax it. The other way, which we're not going with, is if they go into the rec manager function and then they would be faxed directly from there.
I see. This links in with that
Yes.
choice. Okay.
So
that makes it more complicated then because Yeah, I thought we were just talking about laboratory requisitions when we're making this choice, but now it also involves external referrals.
Because
Mm.
from this letter, there's no fax number. So program support wouldn't know where to send it to, right? Because our physicians are just typing in the name of the clinic or the physician.
That's a good point, Sally. I know from my experience, I've seen physicians put in the contact information in those, the order comments, for example, so that it does print out on the requisition so that the clerks know where to fax. Yeah, I've seen some providers do that. We can also, favorite orders on the provider side so that if it is somewhere you're commonly referring to that's not in CST Cerner, you can already have all that pre-populated in the special instructions. And that seems to work well for providers too, because if you have a handful of clinics that you're referring to and you already have their contact information, we can just spend a few minutes building up those favorites, plugging them into your quick orders page. Because I
would
think
demo that, Jessica, just to show what one sample would look like. Because I think you can have multiple of those, right? Like if you have 5 common clinics that you refer to, you could save it 5 times.
Oh, yes, absolutely. Yep. You can come. Yep, I can do that. So I will come in. Let me modify. I'm just going to say next available, locations paper. Maybe I leave the reason blank, for example, but in special instructions, maybe give me an example. I don't have to have a number, but what would be a clinic that would not be live that you may refer to?
The Richmond cardiology clinic.
Yeah.
Perfect. Okay, and then I could put phone, fax, something like along those lines. Janice, is that what you have in mind, or is there something else?
Just put 604, 555 5555 or something. And then
Perfect.
number 11111 or something.
Or maybe I do 555
Yeah, there we go.
Yep, that works too. But so just so you can see what that looks like. So you don't have to pre-fill everything in order to favorite an order. The more information, that you're commonly repetitively putting in there, I would add that to the favorite. But like for example, if this is cardiology, I don't know, maybe I'll just leave it blank, but I'm just going to come up above and right click on the order and I can add it to my favorites. What I can do here is just put referrals works. And okay. And I can come in. So what I could do is I could have a blank reason for referral, but then I could come in and say, I'm just going to say hypertension here. I can refavorite that one again. You can also refavorite this order with other clinics in the special instruction. So it doesn't have to be favoriting cardiology clinic, multiple times. It could be other clinics and other phone and fax that you want to include there. Is that enough, or do you guys want me to add another one just for?
Yeah, and then you can just show what it looks like on the other side.
Perfect. I'll cancel here. So a few places where your favorites can show up on your quick orders, since I'm here. Under new order entry, I'm just going to look here. So outpatient orders, I can see my favorites folder referrals. And when I click on that folder, and let me just make this a little bit bigger on the screen. When I click on the folder, I can see there's my cardiology clinic, there's their phone and fax. If the patient's being referred for hypertension, I could pick that one easily. Or I could just go in and fill in the reason for referral for the patient, since it probably varies. I also, Dr. Lai, I'm not sure if you do this with your other favorites, but you can also go in and actually add folders face up as well. So I could pull in referrals to show face up. Oh, looks like my screen sharing just went away, sorry. Sure what happened there, but you can also pull the folders face up, which I think is very helpful to be able to see those orders and be able to quickly pick them and proceed.
What's the recommended workflow? Say if I've generated the letter and whether it prints automatically or goes to the requisition manager, I haven't decided on that yet, but what's the recommended workflow after I've done that? And now I need to send it, but along with like imaging, my consult letter, some labs, I need all of those to be sent at the same time as the referral letter.
Now, I know that when we were looking at the provider letter, for example, you can add attachments there. So if, you know, if there are documents, for example, you can add them there. And I'm sorry, I'm trying to pull up the domain again. It crashed on me, but so that's one way. Janice, do you know how other clinics are? Just trying to think how some of our others are doing it.
If the clinic is on Cerner, it makes it easy because they can just log into Cerner and view the information. But if the clinic is not on Cerner, then you need to fax all that information if they're not able to view the information in Care Connect. Like, I don't know if all these other clinics have Care Connect access. Just so that you're not having to print everything and send it along.
I would say that most of them, they have access to Care Connect, but they won't actually do it because it's a slowdown for their process. So if I want them to have the information, I have to fax it. So typically when I'm doing in profile is I generate a task to fax the referral and I link in all of the documents that I need faxed all into that task. So is there a way of doing something similar?
Oh. So maybe I'll just lean on Erica. So there's a way for you to have lab results and like medical imaging results all attached to a document that you can fax along. I don't know if you can demo what this looks like. Just so that we can see if we can mimic what you're doing in profile. I'm not familiar with profile, so I'll have to lean on Erica to help me. You're muted, Erica.
We can take that away and cross-reference that because we don't have a demo environment set up to show that this morning. But so you're tasking this to the admin staff, and then the admin staff are printing everything up, Leo. Do I understand that right? And then faxing it over to the non-profile clinic.
Yeah, from my end, I'm just tasking
Yeah.
them and linking out. I don't know if they
Yeah.
actually print it out because
They probably do, yeah.
Yeah.
So
Yeah.
essentially it's like putting it in the order in
Okay,
Cerner.
but when you
Yeah.
say the linking, I'm just trying to envision what the linking is. Like, are you actually, is it kind of like file drop, like, drag and drop a file into like an email and then the email gets sent to like a clerk? Is that what you mean by linking? Or are you just saying like, make sure you include, labs and imaging? It's sort of like a text that you send to the clerk and then they will go in and find the documents.
No, it's an actual link, like a hyperlink. You can do that on profile. Like if anything has been uploaded to profile, like a cognitive test, any document, you can create a link to that document and then they can just click on the hyperlink to get to the document that I want to be faxed along with the referral letter.
Yeah, unfortunately, Cerner does not have that linking functionality.
There's
So because Leo and the team are still going to have profile access for fillable forms, could they do these referrals in the same way and just keep using profile, Janice? Or is that something we can take away and talk about as a possible workflow for them?
Yeah, it's gonna be really tough working out of two systems, like UBC Hospital and the Center for Brain Health. There's a couple of clinics that are, because they had like 200 plus PDF forms that we could, bring into Cerner. The idea was that they would use profile for that, but for the first month, it's been really challenging trying to get them to navigate the two systems. So it's doable. It's just learning curve and trying to figure out a workflow.
Okay.
So that you're not having to flip back and forth so often.
Okay.
Which is my concern.
Yeah, no, absolutely. That makes sense. Maybe as a next step, what I'll do is I'll take some time to go into profile and just have a look at what you're doing, Leo.
Mhm.
And then see, and then I'll work with the Cerner team to see, you know, how closely can we replicate it and what can we get to? And then maybe I can just check in with you over email with a suggested path forward. Sound okay?
Yeah, sounds okay.
Okay.
Thank you.
We are getting close to time. It's almost 10:30. And here I started us out saying maybe we'll let you go early. And so we didn't do that. So I apologize. But maybe we want to just leave the last 2 minutes in case there's any remaining questions that folks on the line have for Leo, or if Leo, you have any remaining questions for us. We've covered a lot of ground today, though, so that's great.
No other questions for now. Thanks.
So I just want to confirm if we've made a decision on the e-faxing or the printing, or if you need more time to think about it and need to see something else. I don't know if we actually landed on a firm decision.
I think right now it makes more sense to do the automatic printing, the option 3.
Yeah, we'll stick with auto printing for now.
Okay.
And we can work on figuring out a way to mirror this linking functionality. Erica, I have one idea that I can test out with you.
Great. I have some time this afternoon, so I'll take this away and I probably will reach out Sally and Leo over email about this, if that's okay.
Okay.
Jessica, thank you so much for doing demos for us this morning. That was really helpful. Is there any questions from you, Jessica, or from the CST team for Leo and Sally in our last minute?
I don't have any questions.
All right.
Dr. Lai, do you have any questions for provider adoption or about any of the adoption activities? I know you've met with Johanna before and you've maybe been involved in some of our champion meetings, but do you have any questions for us at this time?
Nothing more at this time. Thanks.
One quick question I had for you, Leo, was when you went live with Cerner at St. Paul's, did you have anything called a personalization session before you went live as part of your training?
It was a while ago. I don't recall anything specifically right before the clinic took over, but it sounds familiar for some reason. I think it might have been part of like the initial Cerner training, which took place like years before the actual osteoporosis clinic adopted Cerner.
Okay. Like, did anybody from like a provider team sit down with you and help you set up your page, like favoriting like your orders and things like that?
This seems really familiar. It would have been like back in 2019 or something like that.
Okay. Just I wasn't sure if that happened with the clinic go lives, because it kind of happened quite rapidly, but I was just saying that for Richmond, for sure, every provider has like a personalization session with Jessica's team to help you set up your page and favorite things. So you don't have to worry about memorizing everything that Jessica just showed you, because they'll do it with you again. Okay.
Yep, that's right. And even if you had a personalization session in the past, would still like to spend time with you and just help optimize your profile, favoriting orders, creating any documentation templates that you're interested in. So we'll be reaching out to you, but you're always welcome to reach out if there's anything we can help you with in the meantime.
Thank you.
Great. All right. Well, we'll end there. Thank you, everyone. Have a beautiful rest of your day.
Thank you.
Thank you.